Governor J.B. Pritzker holding up legislation he signed yesterday that allows for universal mental health screenings in K through 12 schools here in the state of Illinois. I'm Greg Bishop. It is Illinois in Focus Daily, where we wake you up each and every weekday morning with a review of things that are impacting you. And of course, Illinois schools, they have 800 plus school districts. I think we've got the most number of school districts in the country, but obviously your property tax is driven a lot by the schools. If you look at your property tax bill, most of it's going to your local school district, and the state is giving $350 million more each year to K through 12 schools. There was a long committee hearing yesterday, and maybe we talk about it on Monday, but there was Chicago Public Schools going to an Illinois House committee talking about how much more money they need and how they need no more program funding cuts, and they just need more money. So obviously K through 12 education takes a lot of funding, but there's also a lot of criticism. Some saying that the K through 12 school system in Illinois, especially in some areas, needs a lot of improvements. That the bounce back from COVID has not happened as quick, and a lot of young people are not advancing as they should. So a lot of criticism for schools. But one thing that is obviously a major point of focus for some Democrats at the State House was ensuring that children have the proper mental health supports. Now, Republicans do also acknowledge the importance of focusing on mental health, but they differ on how to go about that, especially when dealing with public schools. So a measure ultimately came out of the Illinois State House during spring session that would bring about mental health checks at schools. If you go to thecentersquare.com, you'll see mental health screening may have long-term impacts in Illinois, according to a legislator. So Senate Bill 1560, as Jim Talamonte reports, it essentially allows for mental health screenings at public schools starting in 2027. Here's Governor J.B. Pritzker talking a bit about it yesterday.
We know how transformational these screenings can be for kids at this age. They provide early identification and intervention so that those who are struggling get the help that they need as soon as possible. They provide early identification and intervention so that those who are struggling get the help that they need as soon as possible. They improve academic and social outcomes. They help us break down the stigma that too often is a barrier to seeking help.
And the state's superintendent of education, Tony Sanders, he also talked about how he sees this as being a huge benefit to have mental health screenings for Illinois public school students every year.
As the governor said, like vision screening, hearing screening, and dental screening, mental health screenings will help us provide timely and appropriate interventions. The earlier we identify the need, the better support we can provide that to students to help them thrive in school and in life.
Now, not everybody voted for this. People have legitimate concerns. One of those who had concerns, State Representative Stephen Reich, he was part of a different news conference with the Republicans critical of DCFS, and we did that in the previous segment. But he was asked at the tail end of that news conference about this bill that the governor was preparing to sign yesterday. Measure, again, to have mental health screenings. Again, mental health screenings that are not mandated. Parents can opt out, but school districts cannot opt out. And it's only for public schools. But regardless, Reich said that it could have some unintended consequences down the road in that child's life.
And frankly speaking, universal mental health screenings is not going to, it sounds great. It's something, oh my goodness, we do need mental health care in this state, and that is a crying need. It's from birth to death almost. But the fact is that universal mental health screenings are going to get us nothing except possibly finding reasons for denial of coverage of insurance, or running afoul of all sorts of requirements for confidentiality. We end up having kids who are screened as potential with some sort of potential mental issue. You don't know where that's going to lead, and I don't think this bill put us in any position to say that once we have universal mental health screening, what's going to be the result? Where are we going to go with that? What's going to happen when kids become adults and they look back and they say, oh, this guy had a certain amount of had indications of such and such. I'm not going to say what. No, that is a slippery slope, and I just could not support that.
So again, Reich wasn't the only one not supporting that. A whole host of people pushing back against it, ultimately raising questions. Again, Reich saying that it could have long-term implications. Maybe a kid is misdiagnosed with a certain type of mental condition, but then he grows out of it by the time he's 18, 19 years old, but somehow this is going to be there in the background, or maybe there's a mental health provider that's not up to snuff and causes some serious damage for a whole host of people and their young developing years in a school. Maybe you get some questions that the mental health experts are asking these kids. Just looking at the live chat, a couple of questions arose here. For instance, do your parents own a gun? Is that an appropriate question for a youth to be asked by a mental health provider? Are there going to be things that are off limits? Are there going to be things that they're going to be required to ask? Another thing is, a listener on the live chat says, would these mental health screenings be used to possibly prevent someone from owning firearms down the road? I have a friend from high school who was brilliant, and they wanted to go to West Point when they were young, and they had some issues with, mental health early on, or at least they were given a certain type of medication to deal with it as a child, but somehow that caught up, and even though this person was brilliant, wasn't able to advance in that, and they ended up going into a similar field and excelling there, obviously. But it's interesting how a child's history, even in the mental health space, could impact their future down the road. Maybe again misdiagnosis, maybe again a fostering to a certain type of mentality that's not necessarily healthy. I mean, there's a whole host of concerns there, obviously, but the governor signing this yesterday, and it's got some people raising some red flags. The governor yesterday also was asked about the Evanston school district here, the school district where he signed this. Apparently, the U.S. Department of Education is investigating Chutes Middle School in Evanston because of what could be how the school handles diversity, equity, and inclusion, for instance. And you've got these types of investigations being requested by parents in some cases, or the DOJ is just coming in on their own. But Pritzker says the DOJ investigations are, quote, BS.
I can't speak to the investigation that's going on specifically here, but I can speak to more broadly the investigations that have been initiated by the DOJ. And that is that many of them are just plain BS. And they're seeking to attack places where they think there are people who are vulnerable, because if they can make you fearful, maybe they can make other people fearful.
And he says that's a tactic that's as old as time. But we'll see how that comes out, if there are findings in this investigation and so on. All right, it's Illinois in Focus Daily with the Center Square. I'm Greg Bishop. Get more headlines at thecentersquare.com. And wake up with us each and every weekday morning here for more Illinois in Focus Daily.